Joint pain is the biggest reason seniors have to take time off from their daily activities. It's painful and frustrating, but it doesn't have to be this way. I'm a doctor. And today I want to discuss how you can keep your joints feeling young and help degeneration of your joints from occurring. I know that sounds like a tall order, but I promise you it's not as hard as you think. And you don't need to spend a lot of money on fancy treatments either. Now, here's what we're going to talk about today. First, we'll discuss the most common types of joint pain that people over 50 experience. Then we'll go over 3 strategies to help you combat joint degeneration. I'm telling you, you won't believe how easy these are to incorporate into your daily life. And for those of you who are new to my channel, an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. This video series is created to help answer some of your medical questions, and the questions that are commonly asked by patients each and every day. If you find this video helpful, please do me a favor and subscribe. When you do that and hit the notification bell, you let the platform know that you'd like to see more videos like this one. Alright, let's dive right into the world of joint pain. So when we're talking about joints, there are several different types of pain that can affect people over the age of 50. Osteoarthritis is probably the most common type of joint pain that you will hear about. Now, osteoarthritis is caused by years of wear and tear on your joints. In fact, most people with osteoarthritis have some type of injury or overuse of the joints that occurred earlier in life that eventually led to the development of arthritis. Osteoarthritis causes the cartilage within your joints to break down. Cartilage is a tough, flexible tissue that cushions the ends of your bones where they meet at a joint. As cartilage breaks down, bones start rubbing against each other, and that causes a lot of pain, stiffness, and sometimes swelling in your joints. Another condition called gout can also cause joint pain. Gout happens when uric acid crystals build up in your joints, causing severe pain, inflammation, and sometimes even damage to your joints. Gout often affects the big toe, but it can happen in other joints throughout the body. You may even have more than one type of joint pain. Many people over 50 have both osteoarthritis and gout. So now that we understand a little bit more about joint pain, let's go over 3 ways to help prevent degeneration of your joints. Number 1, lose weight. Losing weight is the most important thing you can do if you have joint pain or you worried about developing it. In fact, I would argue that losing weight is just as important as taking your medication properly. If you have any type of chronic medical condition, most people just don't understand how powerful it is to lose even just 10-20 pounds on your joints. Every pound you carry around on your body requires your joints to work harder. That extra stress can cause more wear and tear on your joints, leading to faster degeneration. One study found that people who lost even a small amount of weight, about 7% of their body weight, had less pain and improved physical function. So that means that if you weigh 200 pounds, you should aim to lose about 14 pounds. It won't be easy, but the payoff will be worth it. The second way you can slow down joint degeneration is by exercising regularly. Now, I know what you're thinking. The last thing I want to do is put more stress on my joints. But trust me, exercise is one of the best things you can do for your joints. Exercise helps maintain a healthy weight. And remember, weight loss is huge when it comes to slowing down joint degeneration. Exercise also helps strengthen the muscles around your joints, which provides stability and support. This is especially true of high-impact exercise such as walking, jogging, swimming, cycling, dancing. Anything that gets you moving will help your joints. But we're not done yet. There are many different types of exercise you can do to strengthen the muscles around your joints. Resistance training, also known as strength training, is great because it helps build muscle and improve joint stability. This can be done with weights, resistance bands, or even your own body weight. Yoga, Pilates, and Tai Chi are great low-impact exercises that focus on balance, flexibility, and strength. These can all be done with very little impact to your joints. Now, no matter what type of exercise you choose, make sure you start slowly and gradually increase the intensity and duration. Don't overdo it, especially in the beginning. If you haven't exercised in a while, start with just a few minutes each day and slowly work your way up. Also, make sure to warm up before exercising and cool down afterward. Stretching is a good way to warm up your joints and muscles, and it also helps improve flexibility. Examples of stretches for the upper extremities include shoulder rolls, arm circles, and wrist curls. For the lower extremities, you can try leg swings, hip circles, and ankle rotations. If you have osteoarthritis, it is recommended to do low-impact exercise such as walking, swimming, or cycling because they put less stress on your joints. However, if you have gout, you should avoid high-impact exercise during a gout flare. High-impact exercise may worsen the pain and inflammation associated with gout. Once your gout is under control, though, you can resume normal exercise. Here's something else to keep in mind. If you have joint pain, it's important to listen to your body and rest when needed. Pushing yourself too hard can make joint pain worse. The key is finding the right balance between exercise and rest. Finally, 3. Eat a balanced diet. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean protein can help reduce inflammation in your joints. Inflammation is a natural response to injury or infection, but sometimes it can become chronic, meaning it lasts for a long time and doesn't go away. Chronic inflammation has been linked to the development of many diseases, including heart disease, cancer, and arthritis. That's why eating a healthy anti-inflammatory diet is so important. Let me give you an example. Omega-3 fatty acids have been shown to reduce inflammation in the body. You can get omega-3 south from fish like salmon, mackerel, and tuna, or from plant sources like walnuts and flax seeds. Turmeric is another example. Turmeric is a spice that's commonly used in Indian cuisine. It contains a compound called curcumin, which has anti-inflammatory properties. Studies show that curcumin may help relieve symptoms of osteoarthritis. No matter what type of diet you follow, it's important to avoid processed foods, sugary drinks, and unhealthy fats. These foods can cause weight gain and inflammation, both of which can contribute to joint pain. Processed foods are often high in sodium, which can cause the body to hold on to water and increase inflammation. Sugary drinks and unhealthy fats are also high in calories, which can lead to weight gain and joint pain.
Yes.
There are certain foods that you may want to avoid if you have gout. Since gout is caused by a buildup of uric acid in the body, you'll want to avoid foods that are high in purines. Purines are found in organ meats, seafood, and sugar-rich foods. When purines are broken down, they produce uric acid. So if you're trying to lower your uric acid levels, you may want to avoid these foods. So to recap, we've talked about 3 ways to help prevent degeneration of your joints. 1 is to lose weight. Losing even a small amount of weight can make a big difference in the amount of stress on your joints. 2 is to exercise regularly. Exercise helps maintain a healthy weight, strengthens the muscles around your joints, and improves overall health. And 3 is to eat a balanced diet. Eating a healthy diet rich in fruits, vegetables, whole grains, and lean protein can help reduce inflammation in your joints. If you're already suffering from joint pain, there are still things you can do to help alleviate your symptoms. Over-the-counter pain relievers like ibuprofen or acetaminophen can help reduce pain and inflammation. If you're looking for a more natural approach, you may try applying heat or cold to the affected area. Heat may help relax the muscles around the joint and improve blood flow. Cold may help reduce inflammation and numb the area. Either way, you should see some relief. If your joint pain is severe or doesn't respond to treatment, it's important to see your doctor. Your doctor may recommend a corticosteroid injection into the joint to help reduce pain and inflammation. Or they may recommend a total joint replacement, such as a knee or hip replacement. There are a lot of options available to help you manage joint pain and prevent degeneration of your joints. So don't give up hope. Try different things until you find what works best for you. And that's it for today's video. I hope this video was helpful and answered some of your questions. If you're looking for additional resources, check out the links in the description below. Please remember to share this video with others. Until next time, stay healthy, stay happy, and stay safe.